So we're here with Dr. Thor.
Loehr.
Dr. Loehr, but his hands are more magical than Thor's hammers, is what we like to say. Now, we've already done my personal assessment, which is great. You've done x-rays and everything, but now you're going to crack my back. And people say that, but it's more than just cracking backs.
Yeah, it's a little different than that. In fact, most chiropractors don't want to hear the word crack. All of that school we go through to get our doctorate, when we're doing an adjustment, most chiropractors are going to be like, don't call it cracking.
Yeah,
but
adjustment.
But I don't care if you call it cracking. It's fine.
Yeah.
I'm probably that other extreme where it's okay. But that adjustment, there's a whole lot more to it. One thing that I want to say is, which I don't know if we've been through yet, it's not the bones kind of snapping in there. When people hear that crunching noise, they think it's the bone rubbing together or cartilage kind of moving in there. That is just air that's around a joint capsule or inside a joint capsule releasing. It's kind of like a champagne bottle starting the party. That popping
Now
noise.
you're talking everybody's
So
language.
those bubbles come out, the air comes out. That's what gives it that noise when you pop the cork. It's also what the popping or cracking when you do an adjustment, that's where that comes from.
Okay, let's pop some corks.
Let's do it.
So I'll just get on like this.
Yeah.
Right?
There and go face down. I mean, let's not ride it. We're going to go ahead and lay down.
Okay, all right. We do this.
Like
And
a
Dr.
grinding
Loehr,
bull.
you guys do so much more than just, cracking backs.
Cracking backs.
No,
we do.
yeah, you do women's health. I know you've been talking to my wife a little bit.
Yeah, so we do a lot more. We're trying to really just form a natural health center. So things we do, we have our own lab here, so we're doing labs and blood work. We have a chiropractic internist that does functional medicine, so we're looking at organic problems. You could have a liver problem. A lot of times those things can be treated without medication, just by diet, exercise, supplements. So we have that kind of stuff.
Or stop drinking.
Or
if
just
you,
stop
if you
drinking.
have liver problems.
The liver problem
Right.
usually
Yes.
comes from drinking.
Yeah.
But yes, change diet, stop drinking. Exercise-wise, we have athletic trainers, so we'll get you in the back and get you on a program, whether that's a rehab from an injury or just try and drop some pounds.
Some LBs. Yeah.
LBs.
And it's preventative medicine.
Yes.
And it's a healthy way. I mean, that's what's
That's
so
the
great.
difference is instead of approaching it with medications or drugs or surgery, we're trying to prevent problems, and if there are problems, we're going to try to treat them naturally first. Now there are people that need surgery, there are people who need medication, and we'll refer for that and coordinate care with their medical doctor if that's the case. But we do a whole lot. The Eastern medicine side, we do acupuncture. We have massage here, massage therapists.
I have a lot of problems in my head. Do you have anybody here that can help with that?
Actually do. I'm bringing on
Okay.
counseling.
Okay, good.
We start on the 17th. We'll have mental health in office. So pretty excited. That will be added to your treatment plan as soon as it's started.
He knows exactly what's going on, man. I told you guys.
So we offer a whole lot more than just the normal chiropractic care, I guess. All right. You guys might want to be quiet for a minute so you can actually hear this crack. Right there.
That is awesome.
You're going to feel it here.
Woo! Wow. That's amazing.
So when we're doing these adjustments, we're just freeing up those joints that aren't moving. Just opening them up. I'm going to do one here on his pelvis. Lay on your side.
Okay.
By the way, I heard your stuff about underwear day yesterday with with Dan on the
Yeah, I know. It was underwear day.
underwear day. Yeah,
Uh-huh.
that was interesting. Right here. I'm gonna roll you here.
Okay. Good. Okay.
Side. On your back.
So now, we mentioned x-rays. You do x-rays to know exactly where you need to be adjusted. So this isn't just, You've looked at my X-rays, and you do that with everybody when you do the personal assessments.
Right.
That's what's so important to get that done first, so you can look at your health history and figure out exactly what you need to hone in on
and correlate it.
Yeah.
So it's not just about feel. I mean, we do a lot with that and the tense muscles and the joints that aren't moving. But if we're not looking at X-rays and seeing what's going on the inside, in my opinion, we're not doing the patient as much justice either. So yeah, everything I'm doing with him right now, by the way, we didn't just lay him on the table. We've had a few appointments to like assess him and make sure that what I'm doing is what he needs. All right, sit up for me. I'm gonna give him a big hug now.
Is my butt hanging out?
A little bit. I actually looked down for you, just in case. Okay. Don't really have to hug him here. I'm just doing that for love.
Yeah,
but
it's a buddy hug.
Lay back, and there's one between your shoulders. Relax.
Oh.
Looks like he's trying to do like leg lifts in the middle of this.
I did. I thought I had to have my legs up.
Yeah, you're good. All right. So the neck always looks the craziest. Absolutely looks like I'm trying to break your neck, but it's never happened yet. Good.
Wow.
Again, I'm specifically working on these joints that he's had problems with and the muscles around them and freeing that up to get normal motion back in there. Just
Man, just don't do this to your friends at home.
This is not a dude.
No, please, just come see Dr. Loehr.
Sit up for me. Let me refill.
All right.
Yeah.
Woo!
Good to go.
Feeling straight, feeling great. I'm going to go hit the gym here at Loehr Health Center. Thank you, doctor.
Welcome.
Thank you, buddy.